Welcome to my channel. Today we are going to go over some stretching to help with post laparoscopic surgery. I'm making this video because I myself am recovering from laparoscopic surgery and have had quite a bit of neck and shoulder pain associated with it. So some things to note: that the shoulder pain can be caused from gas, the CO2 that they use to inflate your stomach with, can actually push on the phrenic nerve. The phrenic nerve shown here, you can see that it starts at the diaphragm, so just below the rib cage, and it goes up on the left and right side below to each side of the heart, and it kind of comes underneath the rib cage and just underneath the clavicle bone. Here is my bony model. So if we look at the diaphragm here, that nerve goes up and through, and it goes and kind of sneaks underneath the collarbone. So that clavicle, that collarbone, that's where that nerve runs through. It also comes up and attaches to the vertebrae up here in the neck. So it does go to C5, C4, and C3. So if you are having shoulder and neck pain after your laparoscopic surgery, it is possible that CO2 gas is pushing on your diaphragm and causing these muscles to tense up. The nervous system is a lot of fun this way. So some of the movement we're going to do today should help to alleviate your symptoms. Just keep in mind that not all of our bodies are built exactly the same. So I want you to always do what feels right for you and your body. If something hurts or causes pain, I want you to take responsibility and stop when it does. Also, this can be really difficult the day after surgery. So, if you need more time to recover, I'm about 3 days out now. So I'm actually able to take a full breath finally and get some more movement in there. So I think that gas is finally releasing. But part of the nervous system response is to continue to tense up. So sometimes even after that gas has dissipated, the muscles surrounding that nerve are tight. And so hopefully some of this movement that we'll do today will help. We will start with some breathing. So a little bit of education on breathing. When we take an inhale, our ribs expand, the rib cage, the lungs expand, and our diaphragm actually begins to contract downwards. So it puts pressure on the internal organs. You might feel that as a belly expansion. So when you inhale, the belly should expand. But sometimes what happens during inspiration, as you can see on this image here, the SCM, the sternocleidomastoid, during inspiration moves up and tightens. It's more of an accessory muscle. So as you're inhaling, it really should only happen at the very top. What typically happens when we're in pain or we're guarding a muscle or a part of our system that's had surgery, those muscles will work extra hard. So some of these muscles may be a little more overactive on you than they normally would be. So that nerve goes also through this muscle, that second one you can see on this image here, called the scalenes. The scalenes are a very small attachment site just underneath that clavicle. There are some arteries and other nerves and veins that you can see that do come through that space. So as you're stretching, you want to be mindful that you're not getting lightheaded and you're not feeling nausea or the feeling of vomiting. Something that we will work on is exhaling. So because inhaling can be a little difficult right now, especially with the incisions, and then depending on what you had surgery for. So mine was gallbladder, so mine is on the right side. My right obliques, the right side of the body, is very tense, whereas compared to the left side, it's not as tense. If you had something lower, into the lower abdomen, into your uterus, as you're breathing, you might notice as you inhale that contraction downwards, you might actually feel a release in the pelvic floor. Those pelvic floor muscles, as we inhale, kind of get forced to open downwards. So it's not always something that happens on purpose, but it's definitely something we can think about and try to get it to happen consciously. So this subconscious effort or this conscious effort will result in um, subconscious effort. So that is my hope that after we move a little bit today, you'll feel some relief in the neck and shoulders. Breathing also helps to excrete that gas that gets stuck in there. CO2 is the only way that we can get it out is by taking breaths. So if you are walking, obviously most of us cannot do any exercise. So this is about as close as we can get to getting our exercise in, is getting some of these deep breathing and stretching techniques done. So with all that being said, let's get started. Again, keeping care that you're going to listen to your body today. And if anything hurts or gets uncomfortable, you're going to stop and maybe try again in a day or two. So whenever you're ready, you're going to find a spot to sit in. I prefer a chair. Make sure you're kind of sitting at the edge of the chair, both feet flat, hands and arms relaxed. And we'll start with the eyes closed. Start by just taking some breaths in and out. And I want you to notice how big you can make those breaths before you start to feel discomfort somewhere. And just note those areas of discomfort. Note how big of a breath that you're taking. And then we'll start to add some movement to this. So just kind of warming up the neck and shoulders might be just a good starting point for you. We'll start with the shoulders. We're going to squeeze them up towards the ears. And I want you to squeeze them pretty tight. So it doesn't have to be like as hard as you can, but get them pretty tight. Take a couple of deep breaths if you can. Keep squeezing, keep squeezing. And we're going to pull the shoulder blades back, squeezing them together like you're trying to pinch a pencil. Breathe. And then squeeze them down, pushing them down towards the floor. Keep breathing. Again, shoulders up. Squeezing a little harder this time if you can. Squeezing back. Squeezing tight. Down. We'll do this one more round through. Still pushing down, breathing. And back up. Squeezing tight. Deep breaths if you can. Squeezing back. And then squeezing down. Good. Just relax here. We'll do a little bit of movement with the neck because releasing the neck flexors and engaging them can also help release these scalene muscles. We'll do some of that as well. I'll turn to the side so you can see the movement. I recommend doing this in a mirror or with your head back up against a wall. We'll start by bringing the chin as far forward as you can without moving anything but the chin and head. Eyes come straight forward, and then the chin's going to tuck straight back. Good, chin forward. And pulling back. One more time forward. And back. It's going to feel awkward to pull back. Most of us having more forward neck posture, being on our phones and computers, the pulling back action does help to engage these deep neck flexors. So it will release some of that, as well as we're going into the stretches, that might be an option of movement. I'll cue several movements. And then if some of those movements don't feel right for you, you can take those movements out. My pain has been on my right side. Like I said before, the phrenic nerve does come from both sides. I've had occasional pain on the left. I normally don't have any pain like this up in here, so this has been very unusual for me. So you can do this to either side. I'm going to do it exclusively to my right because that's where my discomfort has been. And then if you need to modify that for your body, feel free to take that and just switch up the left and right cueing. So we'll start with just gently pulling that chin backwards and then dropping the left ear to the left shoulder And you should start to feel a stretch, excuse me, either into these upper traps or down here in this scalene area, right underneath the clavicle, front of the sternum. And then we'll pull back. We'll do that 2 times. Chin back just a little, tilting the head, stopping if you feel pain, and taking breaks as needed. One more time. Chin back. Good. And relaxing here. We'll add a little bit more complication to it. Again, try not to do these as hard as you can because we do have incisions. We don't want to create herniations. So just be gentle with yourself as you do these. We'll start with the chin back and the head just tilting over to the left. And if turning the chin down felt good for you, you can do that as well here, or just keep the head tilted. We'll start by creating a simple stretch, reaching the right arm or left, depending on which side you're doing, out in front of you, bringing that arm slowly out to the side, and then bringing it down towards the floor. That feels like the best stretch for me. I'll do it again, and I want you to just notice as you bring your arm up, out to the side, and back down, where you feel the most benefit. Mine is definitely down here out to the side. My palm is pointed forward, and I feel a much bigger stretch here and a little bit down the arm, which is to be expected. And we're just going to hold that for a few moments, trying to take some deep breaths. So we're using our exhalation muscles, our side abs. My right side abs are pretty sore, so I'm going to rely a little more on my left side abs than my right to help pull my rib cage down and away from my torso and stretch this out a little bit more. Good. And releasing that head back up to center. Do a couple of those shoulder circles, just squeezing up, back, and down a few times. Breathing. Good. We'll add a little bit more to this motion as well. Same exact position. I want you to find the stretch that feels the best for you, like that's the right spot. You're going to do your tilt, whatever that is, maybe tucking the chin a little, tilting the head, or rotating. I'm going to rotate a little bit this time because that is starting to loosen up. And we're going to take our hand and place it on the side of your head, the side of the head, the direction that you're stretching to. And we're just going to give it a little pull. The arm can come out to the side again if you would like, or you can just keep it relaxed. And what we'll do here is we're going to gently push our head into our hand. So I am pushing this direction with my head very gently. So you should feel that muscle that is tight. You should feel it trying to activate. And then we're going to slowly release and relax the head nice and slow. Just getting a little deeper stretch. We'll do that 2 more times. Gentle push. Take some big deep breaths. And on your next exhale, relax. One more time. Pushing really gently, activating that muscle. I can feel it stretching. And then exhale, relax. Good. Bring the head back up to center. Shoulder circles again. This helps to just reset the nervous system. It's also a good gauge for you so you can tell if your left and your right side are feeling the same or different than it did before. Good. And we'll do that one more time, but this time we're going to add on something a little bit different. So going into that side stretch, hand assisted, arm out to the side if you would like, or relaxed. I'm going to just relax mine here. And we're going to gently start to push the head into the hand, contracting this muscle here that's tight. And then as we start to relax, at the end of your relaxation, you're going to squeeze your left ear or your head the same direction that you're pulling. So I'm actively trying to pull my left ear towards my left shoulder, not my shoulder towards my ear. Good. It deepens the stretch. It's also a counter contraction for this muscle. We'll do that one more time. Gently pushing the hand head into the hand, and then softly starting to relax, breathing, and then squeezing the head towards that opposite shoulder. So we're contracting this muscle over here. Good. One more time. Squeezing the head into the hand. Slowly relaxing, and then bringing the head closer to the shoulder. Good. Release back to center. Take a couple of shoulder circles. Good. Maybe tilt the head, move the head and neck around. Good. Much more loose. If it starts to feel, again, lopsided, feel free to do it to both sides. Some of those techniques may work better for one side than the other, because this is likely caused by a gas buildup on the nerve. The likelihood of this coming back is pretty high, especially until that gas begins to dissipate. Hopefully, over the next couple of days, that will go away and this nerve will calm down. And these stretches and this little exercise will actually give you more and hopefully some permanent relief. And we won't have any more neck or shoulder issues. If that was a little bit too intense, I have another technique that you can use, because the pulling can be a lot on the neck and shoulders, especially if you have any damaged discs, if you have whiplash, anything like that that creates more imbalance in the neck. Something that might work better for you is a simple breathing technique. We'll start, I always like to do eyes closed, so then you are focused on your breathing. And this might be a little difficult, again, with the incision. So if it's too much for you to do this, drop this and pick it up tomorrow. See if you're feeling better. We'll start with just some nice big breaths, as big as you can. Notice the belly trying to expand. I know it's tight and it may be a little uncomfortable, but as you inhale, the belly should expand a little bit naturally. And then as it contracts, the diaphragm will actually release upward, but the rib cage will compress downward. So you'll feel that pull from the neck. And we'll do that a couple of times just on purpose. We're going to start to squeeze our side abs, not the front abs. So again, depending on where your incisions are, mine are on my right side. So squeezing on my right side is not, it doesn't feel very good, and it irritates the incisions, and I don't want to cause a hernia. So I am just going to squeeze gently. I'm going to exhale. Getting to the bottom of the exhale, we're going to squeeze a little bit more. And I feel a nice opening through the front of my chest on both sides. So that is another technique you can use. You can also add that breathing technique into your arm reaches. So as you're reaching your arms down, you can draw that exhale down. And that way it helps to kind of pull all of these rib cage muscles away from that phrenic nerve. Again, just be careful. Make sure you're going slow. You're listening to your body. Again, there's lots of veins and arteries in here around that nerve. So make sure that you're paying attention, that you're not getting lightheaded and you're not feeling nauseous. We don't want to create more of a problem by trying to solve this one. But honestly, out of the surgery, this neck pain has been the most debilitating for me in my recovery. So I thought I would make this video. I hope it helped you guys. If it did, please like, subscribe. There will be more videos to come as I start to work a little bit more into the core. We work on getting those that incision recovery. I'll show some manual therapy techniques that we can use to help and heal some of that scar tissue as well. So I hope you all enjoyed the video. Thanks so much.